You know what's terrifying? Right now, as you're watching this video, there's a good chance you're taking a medication that your doctor prescribed to help you. But what they didn't tell you is that same drug is slowly poisoning the powerhouses of your cells, your mitochondria. And when your mitochondria fail, everything fails. Your energy, your focus, your metabolism, your ability to heal, all of it crumbles. I'm Dr. John Kim, and today we're going to expose 3 of the most commonly prescribed drugs that are destroying your mitochondria. And more importantly, I'm going to show you exactly how to protect yourself, even if you can't stop taking these medications yet. And you need to watch this full video because the solution isn't another prescription. It's a protocol that addresses the root cause of your cellular energy crisis. Let's start with the first drug. And this one is going to shock you because nearly 40 million Americans are taking it right now. Statins. You know them: Lipitor, Crestor, Atorvastatin, Simvastatin. Your doctor prescribed them to lower your cholesterol, to protect your heart. And yes, they do lower cholesterol, but here's what they don't tell you in that 7-minute office visit. Statins block an enzyme called HMG-CoA reductase. Now, this enzyme doesn't just make cholesterol. It also makes something called coenzyme Q10, or CoQ10. And CoQ10 is absolutely critical for mitochondrial function. Think of CoQ10 as the spark plug in your cellular engine. Without it, your mitochondria cannot produce ATP, which is the energy currency your body runs on. So when you take a statin, you're not just lowering cholesterol, you're suffocating your mitochondria. And the symptoms? They call it statin-induced myopathy. But what you feel is crushing fatigue, muscle pain, brain fog, weakness, and a complete inability to recover from exercise. I've had patients come to me saying, "Dr. Kim, I feel like I aged 20 years overnight." And when I look at their medication list, there it is, a statin, started 6 months ago. The research is clear. Statins deplete CoQ10 by up to 40%. And yet, how many doctors are telling their patients to supplement with CoQ10 when they prescribe a statin? Almost none. This is the gap between what the science shows and what's actually happening in clinical practice. Now, does that mean you should stop your statin tomorrow? No, not without talking to your doctor, because there are people who benefit from statins, especially if you've had a heart attack or a stroke. But what it does mean is that you need to protect your mitochondria while you're on it. Here's the fix. You need to supplement with CoQ10, but not just any form. You need ubiquinol, which is the active reduced form of CoQ10. The dose, at least 100 to 200 milligrams per day, taken with a fat-containing meal for absorption. And if you're over 50, or if you've been on a statin for years, you might need even more, 300 to 400 milligrams. This isn't optional. This is mitochondrial life support. Now let's talk about the second drug. And this one is even more insidious because it's handed out like candy. Proton Pump Inhibitors, or PPIs, omeprazole, Prilosec, Nexium, pantoprazole. You've got heartburn, acid reflux, maybe some stomach pain, and your doctor writes you a prescription for a PPI, and it works. The heartburn goes away. So you keep taking it for months, for years, sometimes for decades. But here's the problem. PPIs don't just block stomach acid. They block the absorption of critical nutrients that your mitochondria need to function. Specifically, magnesium, vitamin B12, and iron. Let's start with magnesium. Magnesium is involved in over 300 enzymatic reactions in your body, and it's absolutely essential for ATP production. Without magnesium, your mitochondria cannot convert food into energy. And PPIs cause magnesium deficiency because stomach acid is required to absorb magnesium from your diet. The FDA even issued a warning about this, stating that long-term PPI use can cause severe magnesium deficiency, leading to muscle spasms, irregular heartbeat, and seizures. But it gets worse. PPIs also block vitamin B12 absorption, and B12 is critical for the Krebs cycle, which is the metabolic process inside your mitochondria that generates energy. Without B12, you get pernicious anemia, you get neuropathy, you get brain fog, you get depression. I've seen patients on PPIs for 10 years struggling with fatigue and memory problems, and when we check their B12 levels, they're in the gutter. And their doctors, they never connected the dots. So here's the fix. First, you need to ask yourself, do I really need to be on a PPI long term? Because most cases of acid reflux are not caused by too much stomach acid, they're caused by too little stomach acid, or by a dysfunctional lower esophageal sphincter. And taking a PPI long term is like turning off your fire alarm instead of putting out the fire. But if you do need to stay on a PPI, here's what you must do. Supplement with magnesium glycinate, 400 to 600 milligrams per day. This is the most bioavailable form. Supplement with methylcobalamin, the active form of B12, at least 1,000 micrograms daily, preferably sublingual or injectable, and work with a functional medicine practitioner to eventually wean off the PPI using gut healing compounds, so you can safely restore your natural stomach acid. This is how you protect your mitochondria while managing your reflux. By the way, if you are tired of being told your labs are normal when you know something is wrong, hit that subscribe button. We are building a community that demands real answers, and I want you to be part of it. Now, the third drug. This one might surprise you because it's prescribed for everything from diabetes to polycystic ovary syndrome. Metformin. Now, I want to be very clear here. Metformin is one of the most widely studied drugs on the planet, and it has benefits, especially for blood sugar control and even longevity research. And this is a big but, metformin works by inhibiting mitochondrial function. Specifically, it inhibits complex 1 of the electron transport chain, which is the first step in mitochondrial energy production. This is actually how metformin lowers blood sugar, by reducing the liver's ability to produce glucose through a mitochondrial pathway called gluconeogenesis. So in a way, metformin's benefit is also its liability. The side effects: fatigue, muscle weakness, lactic acidosis in severe cases, and most importantly, vitamin B12 deficiency. The studies show that up to 30% of people on metformin long-term develop B12 deficiency. And again, B12 is essential for mitochondrial energy production. So you're taking a drug that inhibits mitochondrial function, and it also depletes a vitamin that your mitochondria need. It's a double hit. Now, does that mean metformin is bad? No. It means you need to be strategic. If you're on metformin, you must supplement with B12, at least 1,000 micrograms daily of methylcobalamin. You should also consider taking alpha-lipoic acid, which is a powerful mitochondrial antioxidant that can help protect against metformin-induced mitochondrial stress. And you need to support your mitochondria with the right nutrients. That means CoQ10, magnesium, L-carnitine, and PQQ, which is pyrroloquinol, a compound that actually stimulates the growth of new mitochondria. This is mitochondrial biogenesis, and it's one of the most powerful ways to reverse mitochondrial damage. Now, let's zoom out for a second. What we're really talking about here is a fundamental flaw in the way modern medicine approaches chronic disease. We treat symptoms with drugs that often create new symptoms by disrupting the very biology we're trying to fix. And nowhere is this more obvious than with mitochondrial toxicity. Your mitochondria are the foundation of your health. They produce 90% of your body's energy. They regulate inflammation, detoxification, hormone production, neurotransmitter synthesis, and even how your genes are expressed. When your mitochondria fail, everything downstream collapses. And yet, in conventional medicine, we rarely talk about mitochondrial health. We don't test for it, we don't support it, and we certainly don't warn patients when we prescribe drugs that damage it. But you, watching this video right now, you have the power to change that. You can demand better. You can ask your doctor, is this drug affecting my mitochondria? What can I do to protect them? And if your doctor doesn't know or dismisses the question, that's a red flag. Because the science is out there, the research exists, and there are doctors like myself who are bridging the gap between conventional medicine and functional medicine. We're not anti-medication, we're pro-mitochondria. So here's your action plan. If you're on a statin supplement with ubiquinol, 100 to 200 milligrams daily, if you're on a PPI supplement with magnesium glycinate and methylcobalamin, and work with a functional medicine practitioner to address the root cause of your reflux, if you're on Metformin, supplement with B12, and consider adding alpha-lipoic acid and PQQ to support mitochondrial biogenesis. And for everyone, regardless of medication status, eat a nutrient-dense diet rich in healthy fats, organ meats, wild-caught fish, and colorful vegetables. Support your mitochondria with exercise, especially resistance training and high-intensity interval training, which stimulate mitochondrial growth. Prioritize sleep, because mitochondrial repair happens during deep sleep. And reduce your toxic load, because environmental toxins, pesticides, heavy metals, they all damage mitochondria. This is the protocol. This is how you protect your cellular powerhouses, even in a world that's constantly attacking them. If this resonates with you, don't guess with your health. Click the link below to book a discovery call with my team, or watch this video next, what happens to your body after 12, 24, and 72 hours of fasting. Because if you want the ultimate free way to clear out damaged mitochondria and build brand new ones, fasting is the answer. I'm Dr. John Kim, and I'll see you in the next one.